Hello,
Hi, can I speak to Dana Fried?
speaking.
Hi, this is Dr. Sidney. I am calling from the General Hospital.
Hi, Doctor. How are you?
Fine, thank you. How are you doing?
I'm fine, thank you.
That's great. Can you hear me okay?
Yes, I can.
Is this a good time to speak with you?
It is.
That's great. And are you in a private place we can talk freely?
Yes, I am.
I'm sorry I got delayed. I hope I haven't made you late somewhere else.
No, no problem. I was waiting for your call today anyway, so it's fine.
How can I help you today, Miss Fried?
So, I was discharged yesterday from hospital because I had a
Mhm.
severe episode of low blood sugar, which then led to coma. And now I decided to
Hmm.
call you to get some extra instructions and guidance and information about this new disease.
Uh-huh. Okay, what made you come to that decision?
Just the fact that it's a new disease, and I've realized that I need to learn to
Hmm.
live with it and
Uh,
like what it's all about.
so, what are you saying is you were discharged yesterday from the hospital, and what happened
Mm-hmm.
is because of a severe episode of low blood sugar, which led to coma,
Mm-hmm.
and now you feel the need to call for extra guidance and information about this new disease that concerns you.
Yes, exactly. That's what I want to accomplish in this consultation today.
So, let me ask you a couple of questions before we start.
Sure, go ahead.
How long were you diagnosed with type 1 diabetes?
About 1 month ago now.
Hmm. Okay, first I want to know more about how much knowledge do you have about diabetes, as well as to educate you to the expert level you need to reach and give you tools to teach yourself how to know when to be alarmed and when you are doing things effectively in your disease in
Mhm.
order to stay healthy along with the diabetes. Do you agree?
Yes, that sounds great.
Are you having symptoms of hyperglycemia right now or lately, like frequent urination,
No,
increased appetite,
no,
pain or numbness in your extremities, meaning legs or arms,
no.
increased thirst,
Sometimes, not all the
hmm.
time.
unexplained weight loss,
No,
vision change,
no,
right mouth,
no,
yeast infections,
no,
fruity or sweet smelling breath,
no.
itchy or dry skin,
Sometimes, but I find that if I put moisturizer on, it's fine.
drowsiness or lethargy,
No,
or lethargy,
no, not currently.
nausea or vomiting.
No, no, I haven't had these symptoms since I was diagnosed.
Hmm. What kinds of insulin have you already tried?
I don't know the names. I don't have them on me now, but it's the regular ones. But the issue is that each time I take it,
Hmm.
well, most times that I take it, I can feel my heart start pumping faster, and I
Hmm.
feel a bit dizzy.
Ah. Okay. Let's go over through some general concepts.
Okay.
Insulin is the substance that regulates sugar blood glucose level. It's a learning
Mm-hmm.
process each day. Your body changes depending on where you live, whether it's humid, cold, warm, you eat more, you eat less, or you exercise. Diabetes
Interesting.
is a metabolic disease characterized by the presence of hyperglycemia, meaning high sugar in blood. Although some diabetic patients have typical symptoms of hyperglycemia like increased urinating or thirst, in most cases the disease occurs silently until it manifests itself in the medium and long term due to vascular and neurological alterations. Type 1
Hmm.
diabetes, hmm, which is yours, usually begins in childhood or youth under 40 years of age and usually present with typical symptoms of hyperglycemia like the ones I asked you about, plus glycosuria, meaning glucose in urine, and ketosis, meaning toxic blood products. It is characterized by the destruction of insulin secreting cells. Consequently, these patients always require exogenous, meaning pharmacological insulin lab made, not the insulin one can produce by himself. And this is the meaning to maintain a metabolic status, meaning your blood sugar levels to the proper range.
Mm-hmm.
Individuals without diabetes secrete between 20 and 40 units of insulin per day. Half corresponds to basal secretion, and the other half to secretions in response to meal. Insulin therapy should be started in type 1 diabetes.
Okay, cool. So, what high risk complications
Hmm.
can I have if I don't control my blood sugar levels? Or if
Well,
I can't?
the main and most concerning complication of insulin therapy is hypoglycemia, meaning low blood glucose, which is the reason you had to come a week before. Hypoglycemia
Yes.
presents with or without symptoms such as feeling of hunger and restlessness, epigastric discomfort, headache, change in behavior, blurred vision, sweating, weakness, tachycardia in form of palpitations, which are heartbeats going faster, you told me, um, as well as the tremor in form of dizziness, you also mentioned, and other like paleness, confusion, loss of consciousness, seizures, and coma. Mild manifestations are very common. The more aggressive the insulination scheme, the more frequent the hypoglycemia.
Mm.
In this sense, it's important to recommend that you carry a medical alert bracelet and always have a
Okay.
portion of food that contains fast absorbing carbohydrates on hand. For example, 3 tablespoons of sugar, glass of soda or fruit juice, or 3 to 5 candies. It is recommended to avoid sweets, chocolates, or cheeses for past evidence complications that happen. And that when you feel well, eat a slice of bread or any other solid food that contains fast absorbing carbohydrates. Fast absorbing
Okay.
carbohydrate control hypoglycemia in the short term and slows absorbing ones in the medium term. If
Mm.
you don't have the ability to measure blood glucose, it's practical to consume first a sweet liquid soda and then a salty solid, a slice of bread. In patients with severe hypoglycemia, with loss of consciousness, glucagon should be injected so that later they regain consciousness and can consume food.
Hmm. Okay. So, insulin is a potentially lethal drug if I administer it incorrectly. Is that
Oh yeah,
right?
oh yeah. Also, be aware that a number of variables affect the rate of absorption of insulin. For example, the exercise, local massage to the side, and increased temperature or increase the risk of absorption, meaning it will
Mm-hmm.
start working earlier and stop working before you expect it, or vice versa.
Mm-hmm.
We start working later and will stop working later than expected.
Okay.
Hypoglycemia is a very common adverse effect in patients using insulin. Therefore,
Mm-hmm.
everyone should be educated to recognize the symptoms and quickly eat something, an apple, some candy, or anything sweet. The best way to avoid hypoglycemia is to take your dose at the same time you're eating and to eat, not to skip meals. The use of
Okay.
the use of insulin is a very important tool in the management of diabetes. I will be a center member of your personal healthcare team, will, which will be integrated by me as your primary care physician, an endocrinologist, diabetologist, psychologist, and a nutritionist, working with you and being at your service.
Oh, that's great.
Hmm.
So, how can I know I'm under control and that my diabetes treatment is actually working well without seeing you, just in my own, on
Hmm.
my own?
You should make sure to reach the goals of diabetes treatment, which you need to memorize. So you better have them written down somewhere, or if you need, I can dictate those to you now.
Okay, yes, please, I'm listening.
Okay. Before that, you should know that it is more important for you not to be experiencing any of these symptoms we mentioned before of hyper or hypoglycemia. And if present or worsening or cannot be relieved immediately, call the hospital and ask for a new appointment urgently. Secondly, there are some values you need to always check not to be out of, and those are A. A target blood glucose must be always between 80 milligrams per deciliter, 4.4 millimoles, and
Mm-hmm.
10 110 milligrams per deciliter, that is equal to 6.1 millimoles. It is considered that the control is inadequate if the altered blood glucose is greater than 150 milligrams per deciliter, that it's equal to 8.3 millimoles. B,
Okay.
now B, glycosylated hemoglobin HbA1c less than 7 grams per cent, and it's considered inadequate if HbA1c is greater than 8 grams percentage. And C, the last one, average blood pressure values lower than 140 over 90 millimeters of mercury.
Okay, so I wanted to ask you, what is the insulin options that are out there for me?
Okay, let me show you the proposal so you can make good decisions.
Great, thank you.
The types of insulin regimens are three. It's a personal choice, but this is what it's like. The first regimen is the twice daily, has
Okay.
2 injections a day, which are normally given with breakfast and dinner, a mixed insulin that contains short and long acting elements, covers the glucose surge that occurs with breakfast and dinner, and provides background levels for the rest of the day.
Okay.
The second regimen is with basal bolus, meaning tiny amount of the medication in a specific time regulated for long-term control, and there are 4 injections. A dose of short-acting or rapid-acting insulin is given with each meal regimen. That is to control hyperglycemia in the short term for 3 times daily, and then dose of long-acting or intermediate insulin to control hyperglycemia in the long term is given at night.
Okay.
This covers the background insulin to avoid high glucose levels between meals. And the last one, the third regimen, is the continuous, in which a continuous increasingly insulin pumps are being used to deliver subcutaneous continuous infusion via a small subcutaneous cannula. Normally, low continuous dose is given of a rapid acting insulin infusion in a bolus with meals, meaning a tiny amount of medication in a specific time regulated. By touching a pump button,
Ooh.
the cannula has to be changed every 3 days, and the pump is about the
Mhm.
size of a cell phone and can be worn in your belt. This method allows better glycemic control. However, these patients has to wear the device all the time, and can be risk of skin infections at the cannula site. Also, if the pump fails, the patients have no long-acting insulin for long-term control, so can develop hyperglycemia very quickly.
I see. Okay, thanks for those options. Are
You're
there any
welcome.
other considerations apart from my glucose level control that are important for my condition?
There is increasing evidence showing that the control of hypertension is very important in diabetes, since
Okay.
in these groups small reductions in blood pressure mildly decrease the incidence of late symptoms of diabetes like heart attacks, strokes, blood vessels and nerve damage, and even death.
Okay.
Currently, we have evidence showing that tight control of hyperglycemia decreases morbidity, meaning decreasing ocular, renal, and neurological pathology. It's always useful to remember that the greatest therapeutic effort in the management of diabetes should be oriented towards reducing heart attacks, stroke, and blood clots. For this purpose,
Mm-hmm.
control of hypertension in type 1 diabetes, aggressive treatment of hypertension, reduce the mortality from 94 to 45%.
Oh, wow.
Lipid disorder, overweight, and sedentary lifestyle have greater impact than the control of hyperglycemia. So,
Hmm.
so I can't emphasize how important and vital it's for your control to exercise and drink a lot of water. You are an expert about what will or won't fit into your lifestyle. It's
Okay.
difficult to do all the things that are good for your health, even when you have been to medical school.
Well, it's good because I'm drinking water right now. I've also noticed that my blood sugar levels affect my mood and emotions. Do you think is this normal?
Hmm. The idea that insulin affecting sugar blood glucose could to some degree influence emotional behaviors has long been suggested. However, the underlying
Hmm.
mechanisms have yet to be solved, and there is no direct and clear cut evidence demonstrating that such action involves brain serotonergic neurons, which secrete serotonin, the substance in charge of our emotions.
Okay.
Indeed, initial arguments in favor of the association between insulin, serotonin, and mood arise from clinical or animal studies showing that impaired insulin action in type 1 or type 2 diabetes causes anxiety and depressive symptoms along with reduced plasma and brain serotonin levels. Having a disease by itself, if not well contained by oneself or for external influences like fatigue and acceptance that impact you negatively, are putting you in high risk for having a low mood and
Mm.
could affect regularly who is living with diabetes.
Okay.
Diabetes can be very isolating, very scary, and it could make you feel very alone.
Mm.
Because even the people who
Mm.
were there for you, most of them just don't understand what those moments are like, what the highs and the low moments are actually like. So it
Mm.
could be really cheerful being in a room with people you understand, and you could possibly stand up and say something positive to them. So I strongly advise you to try to find and join a diabetes support group.
Okay.
To cope with the situation, think if anything, being a diabetic has probably given more discipline to make you a better professional. If anything, don't let your diabetes stop you. There will
Mhm.
be peaks and drops. There will be hard days, but there will be easy days. And the more you do it, will lead you to gain an understanding. It's like with everything in life, which is about enjoying it, and your diabetes doesn't have to stop you from enjoying things. And you may have moments when it slows you down, but you deal with it, you come back, and you keep going.
Hmm.
Do you have any other question, Dana, from all I have said?
No, no, that's fine. You've given me a lot of information today. Thank you.
To what extent are you comfortable with the technical terminology like glycemia, insulin, bolus, mobility that I use? Were those clear for you?
Yeah, they were clear. Thank you.
So this line is open from now on. Whenever you have more questions for your next visit, it's in which we're gonna evaluate you physically, and I'll personally introduce you to the specialist in charge.
Mm,
You'll get an appointment that comes in your email, and we're gonna
okay.
call to the number you gave us one day before to confirm you're coming.
Okay.
Is there anything else I could help you with? I want to know if there's any other concerns that you might have now.
No, no, that's all great. Thank you.
Thank you very much then.
All right. Thank you, doctor.
Pleasure to help. Bye bye.
Bye.